I'm delighted to join you all to mark this occasion, the 10th Obstetric Fistula Day. This day gives us an opportunity to reflect on the suffering of our girls and women caused by birth injuries that are preventable.
Your Excellency, the health sector is very proud of you because you are #1 champion for the welfare of women and children.
Currently, only 61% of women receive skilled delivery, with the rest delivering at home. Most of the women who deliver under unskilled care are young, uneducated, and living in poverty. Therefore, these women are at risk of birth complications which could lead to obstetric fistula, which results from poor access to emergency obstetric care.
We must also discuss the issues of FGM. Difficult it is, we must confront this issue with sincerity and say it has to stop, one or the other. Whether we use legal means, social means, whatever, you just have to stop. Because it's contributing also to what we are dealing with here today, fistula. We also need to discuss the importance of family planning, because if you don't get pregnant, you're unlikely to get fistula. And therefore, the importance of family planning as a major maternal child survival intervention is an issue we need to discuss in our homes, in our churches, in our communities. Because that way, we are going to ensure maternal child survival in this country.
Childbirth should be a time of joy and pride for every mother. However, women with fistula lose their dignity and go through stigma in the society. It is a grave injustice that the poorest, most vulnerable and marginalized women are the ones who suffer unnecessarily from a condition that has been eliminated in the industrialized world.
When in places where the services are there, sometimes people are too afraid to come forward. We know there's too many people out there who have been encouraging these women you saw here to arrive today and be here to be able to get the services. So we celebrate them for the courage, for the goodwill they have shown to other women, and the support to be able to bring them here.
Fistula affects women, yes, but it's not a women's issue, it's a human issue. Maternal health care affects women, but it's a human issue. Because what is happening to the sons and daughters of that mother in the home? How does the husband manage in that home? Women are part and parcel of our societies, and I would appeal for all of us to move from the mentality of women's issues to embrace the thought that it's a human issue. And when we give a new chance to a woman who is suffering, it means a chance for her family, for her children, for her husband, and for her community.
As a Flying Doctor Society, is that one day we are going to have a center of excellence where we have fistula hospital just to cater for women who are suffering from this condition.
The good news is that we can prevent, and the good news is that we can treat. Today we have just visited so many women who have benefited from these services here in Kenyatta.
This collaboration effort between KNH and its partners will not only lead to treatment of the affected women, but will also offer training opportunity for doctors and nurses in fistula surgery.
I agree that significant strides have been made with regard to eliminating fistula globally and in Kenya. The government, for example, has intensified efforts to accelerate the availability and use of universally accessible quality health services, such as those related to maternal health, which are critical for reducing birth complications. However, much more remains to be done. County governments must strengthen their health systems with a view to attaining the Millennium Development Goals and national goals like Vision 2030.
Your Excellency, we are also very proud that we are equipping hospitals across the country so that we have many Kenyattas, many fistula camps being held across the country. We cannot just have one center. One center can be a center of excellence for training, but we want our women, wherever they are, all the way from Mandera to Mombasa, to Taita Taveta, to be able to access the same services, the same repair, fistula repair, to be done at the county referral hospital. That is why we're investing. And I'm very proud to tell you, Your Excellency, that's part of the equipment we have provided to 98 hospitals include such equipment for fistula. So in the near future, we need to do similar camps and create demand at the local facility and the local health, county health referral hospitals.
Ladies and gentlemen, we must end this health and human rights tragedy. I urge the civil society and other organizations to prioritize advocacy for maternal and newborn health.